Hello, my name is Jocelyn Hernandez, and this is my reflection video on social determinants of health. And when I reflect on the social determinants of health and I look at financial stability, I'm currently very fortunate. I have insurance, I'm financially stable, I have access to quality health care, I'm attending OU, I live in a safe neighborhood. And socially I'm connected, right? And I have quality access to healthcare, but that wasn't always the case. And I'm older. And so there was a time prior to Obamacare where I did not have insurance. I did not have transportation. I didn't live in a safe area. And I remember struggling to get the care that I needed, right? And sometimes other things were more important than getting on the bus for an hour to get to the doctor, right? I was trying to pay my rent and worried about buying groceries and putting gas in the car. So taking care of my health wasn't always a priority. But through various life circumstances, those are no longer my circumstances today. And what I have found is that now that I work as a community health worker, I have to be mindful that not everybody has the capacity or the capability, the skills to overcome the barriers and obstacles. And so it's very important that I do not allow my experience to transfer to the patients that I work with, and that I meet them where they are at. And so a little bit about what I do today, which is very close to this topic, is I'm a community health worker, and we see all of our patients are Medicaid eligible. We're in California, so it's Medi-Cal, and they have to qualify for our program, which is called an Enhanced Care Management Program, for the following reasons. They may be experiencing homelessness. They may be high utilizers of the emergency rooms and inpatient stays at the hospital. They may have serious behavioral health issues or substance use disorder. They may be transitioning from incarceration. They may be at risk for long-term care services. Or they may be in a nursing home and they're wanting to transition back out into the community. And most of the patients that we see at our clinic, all of them are Medicaid, Medi-Cal eligible. So they are low income, high needs, chronic care conditions, lots of factors that play in to their ability to take care of their overall health. And so at our clinic, we look at the biopsychosocial aspect of assessment, right? We look at everything. When each patient comes in, we utilize screening tools such as a priority assessment and a whole person assessment to determine what are the barriers and the obstacles to these individuals receiving quality health care, and what social deterrents are in the way from them receiving those. And a lot of times, more times than not, especially these past few months, food is a huge deal to a lot of our patients. Food insecurity, transportation. So we help bridge those gaps by providing resources that are available within the community, whether it be our navigation center for housing, our behavioral health system for behavioral health or substance use disorder, the insurance that we utilize. It's a managed care, and they provide transportation to and from all doctor's appointments, things like that. So we really look at helping bridge that gap and looking at those social determinants, right? Because what I am afforded today is not what the patients that I help daily are afforded. And so it's really important that I understand the code of ethics and how important it is for me not to allow my own personal experience, right? My previous problems, right? And how I overcame them to affect my helpfulness and usefulness to the patients that I see. Not everybody is going to be where I was at, to where I was able to make meaningful change, right? And sometimes what it requires is, we can hand somebody a resource, a paper with a resource on it, but that doesn't mean that they're going to walk through it. There's many factors why they may not. So it may be that I have to take the time to make the call with them, follow up with them in a week to make sure that they followed through with that resource. If they didn't, follow back up, encourage them. And one of the things that I utilize in the position that I'm in as a community health worker is the strength-based practice. So I think it's really important to focus on the strengths and not the weaknesses of the patient, because sometimes it can be overwhelming, when they come in with chronic care conditions and they just got out of the hospital again for, whatever the case may be, and it's based off of their chronic care conditions and the maintenance of that, right? It can be very overwhelming. So what I really try to focus on is what's going good for them. And an example is the patient that I just saw yesterday. He came in, he was complaining that he had to move and that he had a roommate that he needed to move as well because she wasn't on the lease and he was getting ready to move. And so I talked to him a little bit more about that. And he shared with me that he had just gotten approved for low-income housing, which in our community is next to impossible to come up on the waiting list. And so I asked him about that. Oh, wow, you got approved? Yes, that's great. How long were you on the waiting list? 8 years. That's amazing. You got approved for low-income housing. Congratulations. That was some footwork that you had to walk through, I'm sure. The paperwork and the follow-up and everything that they require for you to move in. When do you move in? In 2 days. That's great. Wow. That's amazing that you did all of that hard work to get to this place where you get to move into affordable housing. I'm really happy for you. And then he went on to talk about the issues with his landlord and how she kept raising the rent, and he was just in so much fear that he couldn't pay the rent. And I asked him a little bit more about that, and he said that he went to our local nonprofit legal assistance and took his landlord to court and actually won and was awarded a $6,000 settlement, or I guess judgment, because of being overcharged rent. And so I really focused on how much footwork that must have taken him to walk through that, to go to the legal aid, to pursue filing all the paperwork, to show up for court, right? That's amazing that you were able to do that. And look, you won the settlement. And then he went on and on to complain about how he'll never see the money. And so I was able to say, well, you've done all of this footwork thus far. There are resources out there so that you can recoup the money that is owed to you, right? There's wage assignments. You'll now have a legal judgment, all of the positives. And I said, I am sure that after you've gone through everything you have to get to the place where you are today, that you would be able to utilize those resources. And I'd be happy to give you the information to proceed with that. So just really focusing in on this individual's strengths. The strengths-based practice is where it's at for my clinic for sure. Because, when somebody is worried about housing and worried about food and worried about just making ends meet, man, the last thing that they want to worry about is coming to the doctor to get their sugar checked yet again when they know, they haven't been eating right and the numbers are probably off the charts, right? And what we see is these individuals end up in the emergency room, ending up inpatient, and then end up subsequently coming in for hospital follow-ups. And so we really try to bridge that gap. And so this is just the perfect example of how we do that. And it's an honor to work in this field And I look forward to doing it as a social worker, because right now I'm supporting social workers in this clinic that I work at. So it's really exciting. And I think that is all I have. And I want to thank you so much for taking the time to watch my reflection. Thank you.